Group Introduction. We are Group 4 from the program Bachelor of Medical and Health Science with Honours. My name is William Ngor. Our group consists of three members, which are myself, Norman Sinda, and Aaron Henry. These are our degree proposal for the subject Research Methodology and Scientific Communication. The title of our research is Study on the Risk Factor of Workplace Violence Among Healthcare Workers in Klinik Kesihatan Manggatal, Sabah. Background study. Issue in Malaysia. Government health clinics in Malaysia, including those in Sabah, experience high level of workplace violence. A study done by Yazid et al. 2023, 38% workplace violence in public hospitals, then 24.3% in primary and community care. 70% experience verbal abuse, 30% physical abuse. Why these studies matter? A need of to better understand workplace violence in Malaysian government health clinics for better prevention and management. Introduction. Definition of workplace violence refers to acts or threats of violence, physical attack, verbal abuse, or psychological harm. Lim et al. 2022. Prevalence. Common issue globally, especially in healthcare. Type of workplace violence: physical, verbal, psychological abuse, bullying, harassment. Impact on healthcare workers: stress, anxiety, depression, burnout. Ding et al. 2023. Factors contributing to workplace violence. Among the key risk factors are high patient volume, leads to longer waiting times and patient frustration. Staffing issues: understaffing increases stress for both patients and healthcare workers. Lack of security: infusion safety measures in clinic. Patient interaction: healthcare workers often deal with distressed or mentally unstable patients. Other factors: inadequate reporting procedure and lack of organizational support. Problem statement: focus on Klinik Kesihatan Manggatal. Frequent violence and aggression from patients and families. Challenges include high patient numbers, long wait times, understaffing, and lack of security. Reporting issues: incidents go unreported due to fear of retaliation and lack of organization support. Underreporting: despite Ministry of Health training models, workplace violence incidents remain underreported in Malaysian healthcare setting. Research objective: general objective: to assess the knowledge of workplace violence and its risk factors among healthcare workers at Klinik Kesihatan Manggatal, Sabah. Specific objectives: first, to identify the level of workplace violence among healthcare workers. Second, to identify risk factors contributing to workplace violence. Lastly, to determine the relationship between knowledge of workplace violence and its risk factors.
Now I will explain about the literature review. The literature review for this research proposal is from the previous study. The literature review for the level of police violence. First, from study Halkusing, it's all 2020. Design cross-sectional survey. The population physician number 147 and nurses number 44. The result: 45% experienced at least one violent act. Verbal threats were most common, 42%. Physicians had slightly higher workplace violence rate, 47%, compared to nurses, 41%. Physical assault were rare, 12%. Second study from Sun et al. 2020, design cross-sectional study. The population healthcare workers in emergency department. The result is verbal abuse was the most common form of workplace violence, including sexual harassment, shouting, and swearing. Physical assault, while less common, involved use of hand, feet, or potentially harmful items like knife and bottle. The next study is from Tavia et al. 2024, Design Cross-Sectional Survey. The population is 607 healthcare workers from 10 hospitals. The result, lifetime prevalence of any workplace violence was 68.2% and 59.8% reported 1 year exposure. Verbal abuse, 53.4% was the most common type of workplace violence. Factors associated with workplace violence included age, on-call responsibilities, and work experience. Next study from Bernadette et al. 2020 Design Survey, the population 8,345 nursing professionals in Brazil. The result, 19.7% experienced violence, with psychological aggression being most common 66.5%, followed by physical aggression 50.6% and sexual aggression 0.9%. Psychological violence was more common among male nurses 65.2%. Next, the literature review for the factor workplace violence. First, from study Hartini et al. 2020, the design cross-sectional survey, the population 227 nurses from 12 regions of Jordan. The result, 45.8% of participants had experienced at least one form of workplace violence. Factors contributing to workplace violence included offenders' mental health issues and workplace challenges like long hours, understaffing, and lack of security measures. Next study from O'Brien et al. 2024. Design literature review population healthcare worker in emergency department night shift. The result, organizational problems such as inadequate staffing, long wait time, and lack of security contribute to workplace violence. Workers in the emergency department and night shift were at higher risk due to patient anxiety and delay. Okay, the next literature review for the relationship level of workplace violence among healthcare workers and factors associated. Okay, the study is from Ronnie et al. 2023. Design cross-section study. The population is healthcare worker in Bangladesh. Result, workplace violence was more common among younger workers, aged around 23 to 28, and males. Nurses experienced higher rate of workplace violence. Factors contributing to workplace violence included lower educational attainment, workload, and inadequate hospital resources. The theoretical framework for this research study is ecological system theory, multi-level factor, social, institutional, interpersonal, and individual factors contribute to workplace violence. Interaction of level, patient stress, understaffing, and societal attitude toward healthcare interact to shape violence. Works demand resources GDR model, high demand, patient overload, long hours, and pressure on staff. Low resources, insufficient security, and inadequate staff support. Both increase the likelihood of violence. Next is frustration anger hypothesis. Unmet expectation. Lengthy wait time or lack of care can lead to patient frustration and aggression. Organizational justice theory. perceived fairness, healthcare worker responses to workplace violence is influenced by how fairly they believe organization manages such incidents. For the conceptual framework, first is dependent variable. Healthcare professional experience of workplace violence. The type of violence is verbal, physical, or psychological abuse by patient or visitor. Degree and frequency of workplace violence incident. The independent variable for the study is patient demography, like age, gender, socioeconomic status. Clinical circumstance is high patient traffic, long wait time, and understaffing. Next is organizational factor, availability of training programs, support system, security measure. And next is patient stress and dissatisfactions arising from long wait time or substandard treatment.
So the title of our research is The Level of Knowledge on Workplace Violence Among Healthcare Workers and its Risk Factor in Klinik Kesehatan Mangatal, Sabah. So hypothesis of this research is we are trying to prevalence and intensity of the work violence in Klinikistan Mangatal are higher due to the factors of such as high patient volume, limited resource, and high level of stress among healthcare workers. So the key point for this research is the study design is cross-sectional study with a quantitative approach, and then we go into study setting clinics that is in Kyrgyzstan Mangatal, and then the study of the population is the healthcare workers involved in patient care. So the study design we are using is the cross-sectional study with a quantitative approach. So the data will be collected using a structured questionnaire. Then will be using a focus on identifying prevalence types of workplace violence and contributing factors of it. Then who is the target participant is among the physician, the nurses, assistant medical officers, pharmacists, and administrative staff. Then we are targeting about 100 participants for the sample. Then the study settings, okay, Klinik Kestan Mengatal in Kota Kinabalu, Sabah is a primarily healthcare facility, which is having a high patient volume, resource constraint, and high stress uh, with the increasing workplace violence risk. A smaller clinic with a limited security, making healthcare worker more vulnerable to violence. And then the demographic of the patient base, we are focusing on the low-income families, chronic illness patient, and the mental health issue. So the sampling technique and data collection procedure. So sampling technique, which we are probability sampling to minimize the bias and ensure representative of a healthcare worker across various roles at the clinic, and sampling based on the eligibility criteria for consistent data collection. The data collection procedure, we are using a questionnaire distributed via Google Form, and then divided to three sections, that is demographic, considering gender, age, education, and work experience, level of workplace violence, that is physical, verbal, or physiological, psychological, risk factor, causes of the violence, job strength, protection, prevention, and mechanism. So we assures of confidentiality of the data privacy for all the participants. And then software that we'll be using for this data analysis plan is version SPSS version 29.0. The analysis includes descriptive statistic, which is frequency, percentage, and medians, cross tabulation, and correlation to identify relationship between variables, and the result visualized of this research will be presented in table, graph, and charts for clarity. So summary of the methodology, the study of investigate the prevalence types and contributing factors of workplace violence in the Kyrgyzstan Mogata located in KK. And then the finding from the study will provide a valuable insight into the nature of workplace violence in the healthcare sector, helping to inform strategies for improving workplace safety and support for healthcare workers. So conclusion, the study will focus to provide critical insight in the prevalence types and contributing factors of workplace violence experienced by the healthcare worker. So in workplace violence that we are looking into is various type of form, including verbal abuse, physical violence, and threats. Factors such as clinic limited resource, high patient volume, and the socio-economic background of the patient population, uh, we can we can seen significantly increase for the workplace violence. And then frontline healthcare workers such as doctor, nurses, and clinical staff are particularly vulnerable to workplace violence due to their direct interaction with the patient. And addressing workplace violence requires a multifaceted approach, including improved security measures, training for healthcare workers, and conflict management between resource allocation and promoting a supportive work environment. So from here we can see the reference that we will be using for this research. And finally, we can see this Gantt chart that we are using for this research that is will be presented to our uh, lecturers. So thank you for watching and thank you for listening.